Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Welcome, Jennifer Lundman, to the Wellness Law Podcast. I'm so excited to have you here as a guest. Everyone, welcome to Jennifer. She is the Executive Director for the Institute for Behavior Change, which we're going to talk about. What is that? But she's also the former Director of Program Approval at NBHWC, and she's a licensed clinical social worker, an academic, a brilliant mind, and an advocate for the wellness industry and creating standards, which is why I love her. And so I'm excited to hear more about the work that she's doing at the Institute. So welcome, Jennifer.
Thanks so much, Barbara. I'm so excited to be here today.
All right, let's start with the Institute for Behavior Change. What is it? When did you create it? Why did you create it?
Yeah, the Institute. So the Institute for Behavior Change, we really founded in this last year. So over the last year, we were really working with lots of folks in the wellness space to think to what are the standards for coaching specifically in terms of health and wellness coaching? Where is it at right now? And how is it meeting the needs of the kind of evolving healthcare landscape? And is it really meeting those needs in ways that are keeping up with the changes that are happening in the landscape right now? So we had brought together a lot of different groups of people, a lot of different individuals. We brought together healthcare professionals. We brought together various health systems. We brought together coaches, and we started asking really interesting questions about what they could envision the future to be for health and wellness coaching in specifically. And as we were having those conversations, it just became this ballooning idea around the need for the field to evolve to another level. Really thinking about the standards of the industry, really thinking about how we're going to align with the health industry and create that level of credibility and integrity that those health systems are looking for. And so the Institute was really born out of that. It was born out of visioning with just coaching, right? It was born out of visioning with all kinds of individuals who said, I can see something in our future in terms of the way in which this service could live. But we need to think about it maybe differently than maybe we have in the past. So how do we evolve to that place? How do we evolve to that level? And bringing together lots of different groups, subject matter experts in coaching, but in other fields as well to have voice in how that was created. And then gradually really thinking about how those standards come around that industry to make sure we're building the credibility and the sustainability really for the long term. So that's really where it came from, was just a wonderful group of collaborative folks thinking, how are we going to build to the future? Because where we are now is not where we've been. And that the needs now are perhaps different than they've been in the past. So how do we really imagine that and then make it a reality?
Yeah. So I want to really pick up on the group that you're starting with. And I really want to emphasize that it's a start. And you're starting somewhere. I've been trying to advocate for standards in the wellness industry for a few years now. And so when I stumbled upon the work that you were doing, and I can't even remember how I stumbled upon it, but I stumbled upon it and I said, oh my gosh, here's someone who's actually boots to the ground trying to implement standards, but you're starting with coaches who are working inside of the healthcare institutions. And so I want you to talk a little bit about that. Why did you start there? Was there healthcare organizations that were asking you to do this work because they were a little uneasy or unsure of the coaching role, and without standards, this pairing of coaching within the healthcare systems may not occur?
Yeah, I think it was a little bit of both and, actually. I would say that we had coaches that came forward to say, my work is not the same as maybe an entrepreneur. My work in a health system doesn't really look the same. And coaching in a clinical system doesn't look the same as it might look if you were coaching on your own or in a private practice. And I really want to draw that forward in a way that is recognized and in a way that really maybe helps me stand apart from other coaches potentially out there, because I want folks to know that I'm so embedded into a clinical system and I have all this skill set around critical understanding that differentiates me from others. So there was the coaches that came forward. But in our conversations, when we were having these kind of organic conversations with folks, there was a lot of expression with health systems, with physicians, with nurses. We started asking questions about, have you had coaches before? Do you know what coaching is? Do you like coaches? Do you enjoy having coaches in your systems and whatnot? And we heard all kinds of answers of, we don't know what coaching is. We've never heard of it, to, oh, we tried that. It doesn't actually work here, to a level of disbelief, even that coaches could work in a system because they're like, there's that kind of assumption, well, that's associated with social media, that's associated with supplements, that's associated with protein powders and all these other things. And I was like, wait, that's not true, really, of a true scope of practice for a coach. But there's these images that we do have to face. I sometimes refer to the last year that we've been building this as our year of brutal truth, which is really looking at what are the underlying things and confronting them. And this is part of that discussion. It's part of the discussion to say health systems aren't convinced in all cases that coaches belong there. And part of it is because of the level of standardization or lack thereof, the level of governance or lack thereof, the lack of integrity around the profession. There were lots of questions about the research. There were questions about how they knew when a coach was in scope or out of scope and how far they could go in terms of scope. So I think there's curiosity that we're really trying to investigate with health systems, with physicians, with nurses, with other folks who are actually trying to set or trying to think about new ways and innovative ways of meeting the needs of their patients. And so they're curious about it, but they're awfully leery as well. And we
Yeah.
need to confront that. We need to just say, here it is, and here's why. And as we look at why and we look at their feedback, and gosh, we put that feedback in. And we put that feedback into what we build and what we do, and we're mindful of it, we're thoughtful of it. We're not going to take something that we assume to be right and just insert it. Instead, we're going to bring them to the table and they can help us create it. And that's what we really did.
Yeah. It's interesting that you experienced what I call the stigma against wellness, because I also encounter that a lot in the work that I do. I'm trying to bring some, from the legal side of things, some scholarship and some structure around what I call the wild west of wellness. And I keep bumping up against other individuals, other scholars, other lawyers, other practitioners who just think when they hear the word wellness, there's this negative connotation immediately. There's this leap to, oh, you mean like wellness influencers on TikTok and who are peddling fraudulent kinds of advice or products that have no scientific merit. And I'm like, no, yes, that exists. We have to acknowledge it, as you say. But there's also a lot of people drawn to wellness, either as a provider or as a consumer, who want truth, who want trust, who want science backed, evidence based help to improve their well being. And we have to acknowledge that is also part of the wellness community. And that's the part that's going to really, I think, be receptive to the work that you're doing with developing standards. So you're in the process of developing these standards for healthcare based coaches. What's your vision for the Institute beyond the healthcare based coaching for as far as
Yeah.
standard development?
Yeah. And we've done the standards development and we've already psychometrically validated the competencies as well. That's done. We'll be launching our exam here in just a matter of a few weeks in terms of our first beta exam with examinees who are really interested in being a part of how this moves forward into the future. So we've got these wonderful pieces and parts in place. I think one of our next big steps is to think, that's just getting things started. It's just really building some structures that we can then confidently stand upon and feel confident as well about sustainability because we built it with health systems. We built it with healthcare professionals. We built it really tied to and thinking about allied health and the science behind it as well. We built the science right into our competencies, for example. And with that structure, Then we can start to think about what our advocacy looks like. Then we can also think about our clinical implementation piece as well. So on the backside of this, we're actually already building out the plans for clinical workflows for using implementation science to really support health organizations with getting those coaches into place to support patient outcomes. Because it doesn't start or stop with just coaches. You can't just certify a workforce and hope that it all works out. We got to look at then how do we get that workforce in place and do it in a way that meets the needs of those health systems where they're at. We aren't just going to go in and be like, you need to transform your whole health system, and then we're going to put a coach in there. They're not super excited about that. Rather, we got to be able to meet their need where they're at, be able to assess and determine how we can support an implementation of a coach onto a team, and then also be able to work with that team to make that a reality. So when it comes to the Institute's work, we're just getting started, really, in terms of developing structures first. We have another huge arm of our organization that's really looking at the research body, and they've built out 6 pillars really for helping support the research move forward in ways that are generalizable, in ways that are transferable, in ways that we can really build the body of evidence that coaching works. And we're looking to all these structural pieces so that we can get coaches in front of the individuals who need coaching and in all communities as well. So we're really thinking to where are our underserved communities, where are our marginalized communities, where do coaches need to be, and thinking about their training as well. So we're just getting, I would say we're just getting started. Structural pieces were a huge piece of this because they weren't necessarily existing. And now we'll take it to the next level and build the next structure on top of that, but with confidence. And I think that's a big part of it. It was rolling back a little bit, really seeing what's happened in our field and what needs to really structurally be created, and then addressing that. And then we can go forward to those next places.
It's just really, such a relief to hear. If anyone's read my articles on standards, developing standards for the wellness industry, my take on is if the wellness industry doesn't do it itself, eventually other governing bodies will, and will we like the result? Maybe based on my experience as a lawyer helping healthcare institutions for years, probably not, because it's a lot of work and a lot of headache and a lot of expense. And it'd be preferable, I think, to a lot of people, even though they may not realize it, to have, the industry itself, industry insiders be the ones to develop the standards, be the ones to enforce the standards, because then you're opening up a possible national system as opposed to a state by state. If we're going to go
Exactly.
down the road of a licensure scheme, that's a state by state. It presents a lot of administrative hurdles for a lot of people and very expensive as well. So,
Exactly. And we have to think about those other industries as well, because, and this really goes to your point, other industries have no problem absorbing coaching and the coaching competencies into their industry. And we already have industries that are actively just thinking, oh, we can just do this within. We can do this within these other healthcare professional fields, and we'll just become the coaches and we'll be healthcare professional plus coach. And it's
mhm,
going to be great because we'll have all these dual capacities. But if we look to the difference between an expert view, which is very hard to let go of when you're a healthcare professional, and the beginner's mind that a coach carries, there's some fundamental rubs in that. And so we don't want to lose coaching as an independent profession and watch it be absorbed by other professions. What
yeah,
we want to make certain is that coaching has its role and its place, and it's understood. And it's understood because it does have integrity. It does have credibility behind it. That requires, again, those structures, but they got to be mindful of the fact that the landscape includes other professions that are absolutely willing to absorb coaching within it.
yeah. If they can. I talk about that too inside corporate structures. Coaching is a very cognitive and time consuming kind of activity that isn't always promoted within an institution that likes to generate a lot of revenue. And
Yeah.
so
True.
not a procedure. It's a cognitive
It is.
activity, which isn't as financially rewarded in the conventional healthcare system with the
And
benefit.
it's slow. It's slow to really truly meet a patient where they're at in any moment in time and really walk
Yeah.
along with them. That
Yes.
is a slow process. And the
Yeah.
coaches are well trained, especially when we build the capacity for clinical competence around them. They're well trained to not only understand the clinical system, but to understand what that process is like for a patient, because they can really understand from the inside, this is the experience on the health side of things. This is not just a wellness forward thing. We have folks that are confronting their medical conditions and in ways that are really hard and complicated. And we want coaches to really be able to navigate that in the slow movement that it takes to support that patient to move forward in those directions. It's all
Yeah.
supporting the treatment plan ultimately, but
Yeah.
maybe not in that fast paced way that everyone thinks it should happen.
We could get into the billing codes. I don't know if you can just in a minute update us on what, because I know that there will be health coaches who are listening and want to know, can we bill for insurance yet for our services? Do you want to give the quick and dirty answer to that question?
The quick and dirty to the answer is it's to be determined. I think that's the quick and dirty answer to that at this point in time. Not because there's not a number of things at play right now. I think there's a lot of efforts really behind the scenes to advocate for coaches, to advocate for what this looks like within health systems. This is not a lost topic by any stretch of the imagination. I think that there's definitely the world of possibility in front of us. We need to think too, though, alongside with as that happens, that we're ensuring that we're prepared as an industry. Because should coaching codes actually come forward, do we have the right workforce that can actually sit within a clinical system to be able to use that? That's a really important gap and not something I think that every coach understands when it comes to coding. It's not something that it's not something we do just independent of a health system. Codes belong with health systems and work under a treatment plan and work with a physician. And so we need to build that contextual understanding of what that coaching looks like in order to actually have codes be useful. And I think that's a knowledge base we need to continue to build.
Yeah, for sure. And speaking of building knowledge, the institute is hosting an event this summer, right?
Yes, we are. We actually have a whole bunch of events that are coming up here
Oh,
within the short period of time, but our biggest event this summer is the Catalyst Convening. And this is an opportunity for us to bring folks together to brainstorm, to, yes, speak on various topics that are hot to us and think about the structures, think about the pieces and parts, think about the knowledge base that we need to build, what we have, what we still need in order to move forward to really build towards that clinical integration and clinical readiness. We again, back to kind of what I said early on with the Institute, we've built structures, we're still building them because we're as far from done. And it's going to be far from done because this industry has come up, like you say all the time, as the Wild West for a really long time. So it's not going to be a snap your fingers kind of thing, and we'll just have structure. We're going to need to build it over time. And the Catalyst Convening is an amazing place. And then we're going to have some amazing keynote speakers and some amazing speakers as well amongst that community to talk about what we already know and where we still need to go in terms of defining who we are and what we need in order to move forward into the future. It's an amazing opportunity to really bring folks together. I'm really excited about it.
so where is it going to be? What are the dates? How can people register if they're interested in attending?
Absolutely. So registration is going to open up in just a couple weeks, but you're interested in bringing a proposal forward. It is on our website right now at thechange.org. And you can go to our events tab and click down to the Catalyst Convening and find that call for proposals. And just here in a couple of weeks, we'll have that registration link up as well as we finalize our hotels and those kinds of things. It will be in Columbia, Missouri, hosted by the University of Missouri there. And it is July 31st is our welcoming evening reception. And the main event is August 1st and August 2nd.
Awesome. So instituteforbehaviorchange.org if they want to learn more about the important work that you're doing, any socials or other.
We're on Facebook, we're on Instagram, we're on LinkedIn. You can find us in all three places. Mostly on LinkedIn, I would say is the easiest to find the vast majority of information as we release events and those kinds of things. We're trying to make sure that you have all of those professional resources there.
Awesome. I will make sure I put links to that in the description. And I can't thank you enough, Jennifer, for your time today and for the work that you do.
Thanks so much for having me today, Barbara. It's been so fun talking with you.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.